আমাদের পিসি সরকার, দ্য গ্রেট ম্যাজিশিয়ান পিসি সরকার, একটা বক্স থেকে একটা পায়রা উড়িয়ে দিল, একটা রুমাল বার করে দিল, একটা ওটা মানুষকে ভ্যানিশ করে দিল। তো ইট ইজ লাইক দিস, the organs in the abdomen, a pain, acute pain in the abdomen. So all the organs that are there can be related to that pain, or only one single organ is responsible for that pain. So the basics are, today we will be discussing the stomach, duodenum, jejunum, ileum, cecum, ascending colon, transverse colon, descending colon, pelvic colon, rectum, anal canal. From any of these organs, if there is some changes in the pathology, it will be reflected in different locations. There can be some pain that is referred to the right scapula, inferior. Which pain refers to scapula in the right scapula? Which organ? Cholecystitis, gallbladder. Okay. Now, if there is any pain, hematuria, that means blood in urine, it will be related to the organ now. The kidneys, the hematuria or acute, there can be hematuria due to acute pyelitis. It is not always in the renal stone or kidney stone or some nephrolith, small nephrolith. But even a small nephrolith have the size of a small bindi or a musur dal of that small size can give you excruciating pain in the renal angle, and it follows from the kidneys up to the bladder and then urethra and the penis and the female urethra. This is one part. Second thing I told you, I showed you the gallbladder, kidneys. Now gallbladder, this can be acute courses, there be Murphy's sign is there, the liver enlargement due to some hepatitis or obstructive jaundice in the CVD. There can be pain. This is the head of the pancreas. The duodenum comes here, head of the neck, tail. Here is the spleen notch. Tail of the, now these are the organs. Okay. Now regarding kidney stones, pyelitis, urethritis, cystitis, that can be excruciating pain, dysuria, and the fear, the patient with the fear or agony of the pain, they drink less. They drink less. That means that even aggravates the condition where it is there, it aggravates more. Now today you will be given stomach. Now stomach, তোমরা আমার বক্তব্য হচ্ছে you all must You all must aim 60%. একবারে পাখির চোখ 60%. Not less than that. Above you can go. You can fly. So don't panic. I'm telling you, don't panic because abdomen covers a major portion. Abdomen, in this sense, I'm telling the skeletal elements also. The vertebrae, even just your whatever books you are having, don't search for anything, AI, chat GPT and all this, don't go to do this. You just concentrate on your book. You just don't concentrate on your phone. Please don't, because it's small. You're having a small, the writings are small. You have to expand, no network. So these are the conditions. You just draw, like I'm just simply drawing. You're falling asleep, then you draw a diagram like this. Anything, you just draw and label it. Now the stomach, it has two surfaces, two curvatures. Now the cardiac end and the pyloric end, the greater curvature, lesser curvature. Now there will be questions on where is the duodenal perforation or gastric perforation. Okay, what is the cause of gastric ulcers? What is the cause of acute gastritis? And blood supply, lymphatic drainage of the stomach. So the abdominal aorta, that is supplied, branches. And these are not minute branches. You see when you see your books now. But the organs which will be given to you, একবার ফিল করে দেখে নাও, একবার দেখে নাও, একটু চট করে অ্যানাটমিক্যাল পজিশন কিভাবে ধরবে। মানে পাইলোরিক এন্ড উল্টে দিয়ে কার্ডিয়াক এন্ড করে দিলে সেটা হবে না। Because it has a definite it is like this. You have a mesentery here. Now, if you answer very well, what are the structures related to the stomach bed? What organs are there? The stomach bed. A beautiful picture. You download and see it in Gray's Anatomy. It is no picture in any book will give you a sound knowledge of the stomach bed. তুমি ফোন যত ইয়ে করবে তার থেকে একটা ট্যাবে যা আছে ল্যাপটপ যারা আছে তাকে বলো ডাউনলোড করে গ্রেডসটা দেখে নিতে। And if you spend 2 hours or 1 hour in the library, if you are spending AC library with your friend, with a group, then you issue a Gray's Anatomy. You do Bikram Singh, Indrajit Singh, any person, Ashim Datta, whoever's book you are using, don't buy a book or search for, oh, he is reading from Bikram Singh. Hey, ki ache re tora? Don't. It is the same pattern. A nice picture, nice illustration, and that is a different issue. But the basics is that when you ask for what structure is this, আজকাল তো জিজ্ঞেস করে না, ডেড বডিতে তো তোমাকে লিখে দিতে হবে। So you just know the location of the organs and what major artery supply, not the small artery going into this hole and passing and carving and going. It was in our days. You just know the major supply. This is thing. The colon, it has, I told you the other day, These are the tibia, longitudinal muscles forming a band, and that the colon, you see, it will be constricted. You open, if there is a colon open, you see the internal surface, because all that food you are taking, morning you take, say today's diet, এখন আমি একটু ডিটক্স করছি, moringa powder with water you sip, then you take some honey, some your dry fruits and all this, then you take your breakfast. All this has to come down up to the next morning when you go to toilet, and all these things has to be, they'll be digested, some nutrients will be taken, in each part has a different role. So it takes time, the enzymes to action. That's physiology you are reading. Now, this will take time to, so anatomy is that the colon is made at this, the mucous surface, the bulk, whatever being digested and then forming stool, it goes and gets located in different parts. And the ultimate is that it is in the rectum anal canal. And in the oropharynx, pharynx, esophagus, then it goes down. The stomach, from stomach, it goes to the duodenum to jejunum to ileum. If you see the different, the folds of the mucous membrane, the mucosal folds, that gives absorption, more surfaces. That's why what happened, actually, this is the ileum, this is the ileocecal valve, and this is the appendix here. Now, the position of the appendix, the pre-ileal, post-ileal, retrocecal, subhepatic. Because if you go to the development, embryology of the gut, then this part was on the left side. It rotates and then comes down and travels and travels and travels and comes to the right iliac fossa, the cecum, and the appendix is located. Now, all right RIF. The Americans have done one thing, is that all short forms, RIF, right iliac fossa, tender. Tenderness and pain in the right iliac fossa does not signify that it's appendicitis. That you will learn next year, okay? But one thing I tell you, but if you are not matching it does not match with your thinking that, no, it is not, I'm not feeling so, I'm suspicious. So don't label it as appendicitis. You think that it can be on the left side also. Okay? Now, why I told you this? Because your questions, if you answer very well, you might be asked for honors, you might be asked, Jabi, baire jabi? You fast on Shivaratri. I'm telling both boys and girls. But your fate and destiny is different. তো শিবরাত্রির দিন উপোস করবে, উপবাস ভালো, কিন্তু এখন এই পরীক্ষার সময় উপবাস ভালো নয়। একটা অ্যাকিউট গ্যাস্ট্রাইটিস হলে ইউল বি, মানে এমন করে দেবে তোমাকে, মুশকিল হয়ে যাবে। Okay, I'm telling you, like I am Dr. Prabhash Banerjee. I'm a Brahmin. ঠিক আছে? I'm a Brahmin. I do Kali Puja. That is 150 years old in my house. But I take sips of tea, cold drinks, ORS, but I don't go into complete fast. Like in the Ramadan period, rare fossa, so it can be, this can come, cecum can come over here, but it's a very rare condition. Very rare condition. So, like when I was in house staff in surgery, that subhepatic cecum I have seen. So, in the right iliac fossa, if you are missing, then you have to extend your incision or you do a right paramedian incision and go for the appendix. Okay, one thing. Another important thing is that this ileocecal valve, this ileum, and there is it is like this. The Meckel's diverticulum. Meckel's diverticulum, that can be a short note. Meckel's diverticulum. And every time you do an appendicectomy, at least you, from the ileocecal valve region, you trace the ileum and you will see if there is a Meckel's, you see it. Now, if there is a Meckel, then you have to remove this portion and you have to suture the ileum, end-to-end anastomosis. So, Meckel's diverticulum, short note, appendix, the position of the appendix, the cecum, ileum. Okay, this is this part. Kidneys, you get the calyx and you describe the kidney, and the constrictions of the ureter, the last day I told you, where the stones get lodged. Again, with due spasm, and this is less than 1 centimeter, that calculi comes out. But in just the pelvic ileal system, the ureter and the calyx over the get stuck. Then there might be hydronephrotic changes in the kidney. This is one thing. Stomach, you can get ulcers, you can get perforation. In the duodenum, duodenal perforation is most common. And yes, before it was a concept that the now, it was a cause, the cause of peptic ulcers and gastritis was due to the vagus nerve, that disorder. But that in those days, vagotomy used to be done. In this portion, the stomach cut off the vagus nerve cut off. But that didn't solve the problem. But newer drugs came into this ranitidine, famotidine and all this, the PPI, proton pump inhibitors, Reprazole, Opramazole, all these drugs. But the real culprit is H. pylori bacteria. Now, to prove this, I think which year I just don't recollect, in recent times, H. pylori, recent means at least 20 years back or something. You search, H. pylori bacteria was the root cause of this peptic ulcer, duodenal ulcers, and or gastric ulcers. So there's a course of antibiotics, and now the person who won the Nobel Prize for this, what he did, he took the vomiters of his patient and he took it himself, and he took that mucus and saliva and all the patient vomiting, and that vomiters he drank. ভাবো তো তার স্ত্রী, তার বাড়ির লোকজন ম্যাড, পাগল, but ultimately he proved that the symptoms, signs and of this condition, that H. pylori is the cause. Then how many days you will give? So a course of antibiotics for 1 month or something like that, with PPIs. It's a combo. 10 days, 20 days according to the severity. Now it became easier because of flexible imaging. Upper GI endoscopy. The endoscopes came into the scenario, and they took the image plus that is a test, rapid urea test, that it becomes pink. Not exactly pink, it's a shade between purple and becomes, and white is negative. White is yellow is negative. It's a small cassette that they think they suck your material from the mucous membrane and this thing. It is put into the test and then you get a positive. Then you have to give a course of antibiotic. Again, empirically means you don't have a duodenoscope, you don't have the symptoms, signs there. You please prescribe for 10 days or 20 days and see the symptoms relief, and also some antacids, liquid antacids, that you will be studying in pharmacology. Now I'm telling you that patient, like you go to the ward, some bad foul smell in a burn unit or in some surgical abscess has been burst open in the, it can be any region of the body, that you can, if you smell, it has different bacteria have different types of smell. আমি কি বলতে চাইছি, the dedication of that doctor who this thing found that H. pylori is the root of this disease. So vagotomy সব চলে গেল, তার আগে থেকে চলতে বেরিয়ে গেছিল। কারণ দেখবে, one thing I tell you, you go to, when you are going to the market for a biryani or a dinner in Club Central, so before that you take some PPI. বাস দাঁড়িয়ে যাচ্ছে, ওখানে যদি ওষুধের দোকান থাকছে তো সে, দাদা দুটো র্যান্টাক দিন তো, জিনটাক দিন তো। But what is happening, that it is your গলা টিপে ধরে না, সেরকম your blocking, that fails also. But one thing I tell you, how much PPI? You give a course of antibiotics for 20 days or 10 days, according to the severity, some liquid antacids, and PPI you don't give one according to the symptom, not 7 a.m., 7 p.m. Actually, many things are there. These drugs, you give it to the timing, chronomedicine. You see in your, at a গল্প করতে করতে দেখে নেবে chronomedicine. Chronomedicine, chronology with the clock. 7 a.m., 7 p.m. Liquid antacid, which I prescribe 8 a.m., 12 noon, 8 p.m. Yes, I'm telling you. Okay. Now, one thing I tell you, that is vagotomy and all this is not, there's some ulcers. Now, definitely you do a GI endoscopy. Also, at times, for the total now you are doing the upper GI endoscope. Now the duodenum, jejunum, ileum. Now in colonoscope, a small proctoscope, you see the anal, canal and rectum. Proctoscope, you can see the piles and this thing. But that is, you put the patient in left lateral position. The modern medicine technique is that patient is in the left hand, the thigh comes up to the chest, and you put your proctoscope. That is, but again in Ayurveda, Sushruta's technique. Sushruta's technique is what? Patient is in lithotomy. They are not using scopes all the time, but mostly finger. Finger দিয়ে তুমি ইয়ে বলতে পারবে। The patient is in lithotomy. Now you take your finger and slowly put xylocaine or some Vaseline and you coax the patient. Coax means babu, babu, lagbe na, You put your finger on the external sphincter and slowly the mucous membrane, some sentinel pile is there. Now babu, amar lagbe. You just relax. You put your finger and you can feel the fissure, the blue line I've drawn. You put your finger like this, you put up to this, slowly, and you see the piles. You can press, you can see. Okay, you can feel the fissure. But with the proctoscope, even you can see. The proctoscope is designed like this. Now, you hold it like this, you put the proctoscope, this is the thing, this is within the tube. Instead of the finger, this is within the tube. You put it in and you slowly withdraw, you will see the piles. But the fissure, you have to feel it. You put a PR, per rectal examination, and the posterior fissure is there. Even from 2017, I don't operate on piles. I've left it. If there is some excruciating problem, then I think twice. I medicate the patient and lifestyle management. তো আমার lifestyle management হতে শাক. In Bengal, 21 types of শাক is cultivated. Even in the field it grows. So a শাক should be there. Bhendi should be there. Now I have left. People are coming, and our 3 surgeons have said, you have to operate. তো আপনি কেন করবেন না? আমি বললাম, বাবু আমার টাকাটা তুমি তোমার কাছে রাখো, আমি দেখছি। তারপরে যখন when they returned, I asked them, how what is your feeling? অপারেশনটা করে দিই। না, অপারেশনটা করব না। So there are things that's why I put Hippocrates on my right side and left side Sushrut. Take the good of everything. One thing. Now, why I am telling you so much, that these are the condition. It won't be asked, but in clinical anatomy, these are the piles. Okay. Hemorrhoids. Okay. This is the proctoscope. Now, duodenum, stomach, jejunum, ileum, and you just see the inner surface of jejunum, ileum, and your transverse colon or এই কাটা আছে ওই তোর এই ascending colon, cecum, হ্যাঁ, তোমরা একবার দেখে নাও, কারণ দেখো একটা কথা হচ্ছে যে তুমি দেখবে it will be easy for you. এই যে কনস্ট্রিকশনস গুলো আছে, হস্ট্রেশনস বলে,